So with your work specifically, someone comes in, you're doing testing, right? So you're guiding them through this, and then you're essentially recommending, and this is a really important aspect of your work too, is bioidentical hormones, right? Versus, I think the right way to say it is synthetic. Is that the right way to differentiate? I mean, how do we
Yeah,
differentiate?
that's, I mean, I think I don't like the terminology, but yes, that is
Yeah.
kind of the accepted terminology.
And what is the difference between the two for someone who just doesn't know?
So bioidentical just means that the hormones, the chemical structure of the hormone matches that of the chemical structure of the hormone that your body makes. So my body, your body, our bodies, the primary hormone that we make for primary estrogen is called estradiol. So ideally, when you're taking hormones later, perimenopause, menopause, you're taking estradiol. So they look the exact same, they act the exact same in your body. The alternative to bioidentical are what are kind of called synthetic hormones, which again, not the best name, but that's just what they're called. And that's basically anything that is not bioidentical. So it looks a little bit like estradiol, but it has an extra group attached to it. So it still binds the same receptor, but maybe not in the exact same way. So like in the Women's Health Initiative, which you talked about, they used a synthetic estrogen called Premarin, which actually came from pregnant horses' urine. That's where it was derived from. That was the estrogen they used. And that was kind of problematic. But the real problem was the synthetic progestin, which is kind of like progesterone, but like a zombie version of it, right? That was the one that really caused the problems in that study. So most doctors at this point who are doing hormone replacement therapy are using that bioidentical form of hormones, but there are some doctors who still are using the old synthetic versions. And I'm surprised every day when I see those. Unless
Yeah.
there's a good reason, I
Yeah.
don't reach for those first.
Why, if there were bioidentical hormones used for these therapies, why wouldn't they have used those, especially with a study as large as the Women's Health Initiative?
Yeah, I think it probably comes down to who's funding the study. The synthetic versions of these hormones are all drugs. They're all pharmaceutical products, and so we do have pharmaceutical product versions of bioidentical hormones. By the way, you can get those at a regular pharmacy. You don't have to go to a compounding pharmacy, um, but yeah, I think that they also thought that they were going to work. I mean, I think that they were
Yeah.
comfortable at that time. This is what they were hoping would work. And we've learned a lot since then. We've
Yeah.
learned why that wasn't a great idea. I think that that's fine to be wrong, but we just need to know that there are other options out there and we have them and they're not expensive in general. So I think there shouldn't be a good reason now that doctors are not prescribing estradiol and progesterone, which are those bioidentical versions.
What are the core ages that you're prescribing these bioidentical hormones for?
It is wider. I certainly do prescribe them, both of those, in menopause, and those are the kind of, estrogen, progesterone, both. I also prescribe a lot of progesterone, especially in perimenopause. And perimenopause is the 2 to 10 years before menopause. It can start as early as 35 and still be considered normal. It can start earlier if you're premature menopause. But low progesterone is a very common problem in perimenopause. So oftentimes I'll prescribe that then. But then I also use progesterone for things like women who have PCOS. If you have irregular cycles with PCOS, progesterone it's a mandatory addition to PCOS because can have high amounts of estrogen, you're not making progesterone, and that high estrogen over time can be really problematic for increasing risk of breast cancer and things like that. So I use it also in women who have like PMS. If you have a lot of pain before your cycles or heavy cycles or migraines before cycles, any of like PMS symptoms, adding a little dab of progesterone during the second half of your cycle can make a huge difference. It's so easy and it's so safe.